Hi, I'm Mary Wong, and I am a registered traditional Chinese medicine practitioner and acupuncturist, founder of Alive Holistic Health, author to Pathways to Pregnancy, and your fertility coach and mentor. So, welcome to my live post number 80, where I am going to talk to you about acupuncture. And it's a bit of a joke because it is literally my 80th post, and I haven't even talked about acupuncture at all. So, it is time. And before I go on, I want to actually preface it by saying it's because tomorrow I'm totally excited and honored to be providing a webinar for the Canadian Fertility and Andrology Society. So basically, that is fertility clinics across Canada. So, and the reason why I'm doing this and I'm so passionate about doing this is because I get to be addressing complementary and integrative medicine, which includes acupuncture and Chinese medicine, which is what I do. And why do I want to do this? Well, really, it's actually for you. And the reason why I say that is because, like, listen, no one, I wish that one medicine is omnipotent and, it does everything for everyone. However, what we find in practice and what you will experience as patients is that sometimes it requires more than just one thing. It's like a collaboration of everything that can make a difference. So to me, it's like, yes, we need to collaborate Eastern and Western medicine and other natural medicines so that we have this full village, this full breadth of caregivers that can help service you to provide the best care possible. And so why am I saying this? Is because I'm doing a lot on acupuncture. I'm going to be presenting on acupuncture. And I thought, gosh, I'm doing this and it's not for public viewing. So I thought I could bring some of this information and share it with you as a person that may already be doing acupuncture or maybe one day be interested in doing acupuncture. So really, and that's why we call it what's the point? What's the point to acupuncture? And in this particular case is with regards to trying to conceive for fertility. And I'll go a little further in terms of for trying to conceive and even while you're pregnant. Because of course, those of you who've had pregnancies in the past, and it may have resulted, well, either to a live birth and you're wanting a second child, or if you're a person that have been pregnant but has had difficulty staying pregnant or had a stillborn, all those things, well, guess what? Acupuncture you can utilize throughout your whole pregnancy to help make for a healthy pregnancy to term. So on with the show. Well, for those of you who have already done acupuncture, and hopefully you're having good experiences where it's not so painful. Certainly in our clinic, we hear patients tell us like, gee, I wish I started it sooner because I thought it was going to be really painful, and it's totally not. And what we witness is that people fall asleep, which is pretty awesome, and they get pretty relaxed. And so, well, why would you use acupuncture? Well, there are studies out there. Oh, wait, let me start by saying, what is acupuncture? And I'm not going to show you the needle because I'm not here to freak anyone out, but they are tiny thin. So it's like as thin as my hair, typically. And they are sterile, stainless steel, surgical grade, disposable needles. And we put them through the skin, just underneath the skin, above the muscle layer on the fascia tissue. And the fascia tissue, we know in science, is the most electrically active. And it can create like a neurological nervous impulse in that tissue. So the idea is that it sends a message to the brain releases the appropriate chemicals, it communicates with the hypothalamus, a certain part of the brain, the master gland, and then it communicates with the pituitary gland, which controls, both of them, which controls the reproductive organs and a lot of other things, systems in the body. So that's why we utilize it. And how safe is it? Well, studies show that it is really, really safe. What we witness in our office, maybe a bruising here and there, but which should not last too long. And even those of you who are currently at fertility clinics and taking baby aspirins to thin your blood, or fragment while you're gearing up for IVF or in the midst of an IVF, acupuncture is totally fine, totally safe. In fact, we generally don't bruise at all because we're not aiming for blood vessels. We're aiming for the tissue. And with that, then there shouldn't be any kind of drawing of blood. And we do have skin blood capillaries. So sometimes if you nick that, you have like a tiny little bit of drop of blood. And that's about it. And so you get that. Sometimes I would say if you haven't eaten enough, maybe you could be a little lightheaded after. Then if there's a musculoskeletal ailment that we might want to address, sometimes the release of that will make you feel like you've had a big workout and a little sore the next day. That can happen. On the rare occasion, we'll have like a little bit of a treatment response. Some people call it healing crisis, where like you may have a headache. But I'll tell you, anytime you're doing fertility drugs, you're typically getting headaches. And what we're there to do is, in fact, help take away some of those side effects. So that's another reason why we do it. Now, so speaking of which, why are we doing it? What benefits are you seeking? So I've looked through studies, and then just for fun, because I'm doing this webinar tomorrow, I turned to our patients. So we asked 50 patients that are currently doing acupuncture and asked them, hey, why did you seek acupuncture in the first place? And what are you looking for? So here's what the results were, and there's 50 people. First is to help detox and reverse my body to recover its blood flow and cells. And then, of course, it's about successful pregnancy, because ultimately that's what everybody's wanting. So it's about helping to maximize, optimize that. Relaxation. And then outside of acupuncture in of itself, seeing a practitioner who has time for you, whether your treatment is 45 minutes to an hour to sometimes even an hour and a half, depending on who you see, then there's a lot of time for dialogue and where you can have interaction and where you may be able to ask questions, in which at a fertility clinic, they just don't have the time. It's not that they don't necessarily care, although some patients beg to differ, but I say they do care. They just don't have the time. So we're there to provide some time for you. And so what patients are saying, they seek out and they learn about the do's and don'ts to improve chances. They've experienced and are looking for reduced cramping, pain, and stress, improved menstrual cycle and menstrual flow. So, for example, irregularities, or in fact, even no cycles at all. I had a lady who emailed me, oh, I have to email her back to say, oh gosh, like I just got my period and I thought it was never going to come. And it came within 24 hours, maybe even 12 hours. All right. And then the other thing is to help increase effectiveness of IVF and fertility treatments, basically to improve chances. And then providing the candid and personalized dialogue with healthcare provider, improved egg quality, and healthy birth experience. So for that, those are for people that are currently pregnant, and they're looking for that when they do acupuncture. And then regulating hormones, which I discussed earlier. And then easing the side effects of hormones that you're taking from the fertility clinic as you're going through assisted reproduction of any type. So sometimes people are just using timed intercourse, but at the fertility clinic, they're given a drug, something like Clomid, that is oral. Sometimes it's injectable, and everyone responds differently. And some people do have bad side effects, including like hot flashes or insomnia or headaches, migraines, bloating, all those things. Well, we tend to help those mitigate the side effects. We help to increase energy, better overall health, improve mind-body connection, advocate to help make the right decisions. So again, that's back to the communication, because we have the time for you. And then help with insomnia, increase uterine lining, receptivity to uterine environment for those of you, again, that are looking for example, a frozen embryo transfer or fresh embryo transfer to set the lining up for the uterus. One patient says it's in terms of the actual physical benefit, it's the only true relaxation and deep sleep that she got while she was going through the whole IVF process, because of course that's so emotionally and physically demanding and draining. And certainly it imposes a lot of anxiety and fear and worry. So this was the only thing that helped her sleep through the night. So that's fascinating. And again, I'm not making this up. These are patients' physical responses to the acupuncture session. So I thought that was interesting. So these are 50 people. And then so the other question I asked is, well, what's missing at the fertility clinics that you would find allied health professionals provide? Well, prepping your body and uterus and your organ in conjunction with everything. And then, so what's missing to that for the patients at the fertility clinics is acupuncture. Well, that's a case for a lot, but there are a couple of clinics that I know of that have on-site acupuncturists. And certainly there are some that will permit us to go into for the pre and post embryo transfer, but unfortunately it doesn't allow for us to go in for like regular consultations. But to be honest, not the best place for it anyhow. I find that being away from the fertility clinic where there's less stress associated is a better environment to get acupuncture. So for those of you who are considering, I would suggest getting acupuncture at a acupuncture clinic. All right. What's missing at the fertility clinic that allied health professionals provide? So continued. Complementary herbs, education on Chinese medicine and treatment options, more holistic outlook, better emotional connection, which I mentioned about earlier, and then personal relationships with provider, so meaning someone to talk to and bounce things off. And certainly we get asked lots of questions and our opinions, and it's like, should I do this? Or what do you think of me exercising while I'm pregnant? So certainly you don't have the time, the doctors don't have the time to address all those kinds of concerns, and we're here for you. So just choose TCM practitioners that have knowledge in that. I mean, their acupuncture will be great no matter what, but if you want that kind of dialogue of knowing about fertility clinics, you might want to go to a practitioner that has knowledge about fertility centers and as well as the protocols and the drugs behind it. Okay, options for self-care and non-invasive treatments. So again, these are patients, 50 patients that I interviewed or I provided a survey for, and this is what they came back with in terms of what's missing at the fertility clinic. Process is too sterile. I will have to agree with that. I wish I felt like a person and not just a uterus. And someone else says, not just a number. And this is also a common theme that I hear, myself included. Sometimes, again, it's Western fertility, really, it's about specializing. So you're really looking at a very small area. And here is specifically uterus and ovaries and fallopian tubes. That's about it, right? So that's what the main concern is. Okay, so they're missing counseling. So I would say some clinics offer counseling, some fertility clinics do. Address emotional needs, not just physical. That's very true, and that's where sometimes counseling comes in. Now, Chinese medicine practitioners or naturopathic medicine doctors, they're not trained as counselors or psychotherapists. So really, if you need that kind of work, then I would suggest that you go to someone like that with that credential, which may even include someone who has specific credentials for fertility counseling. And there are those that are out there for sure. But having said that, even when you don't, we certainly lend an ear because, as I said, most practitioners, acupuncturists, will give you time, 45 minutes to an hour. So it's a captive audience, right? Well, then there's the thing about enough time with practitioner and physician, which of course in an ideal world, they'll have time for you. But in the real world, they're seeing a gazillion people a day at the fertility clinic. You know that. You've been there when you've been there. And the waiting rooms are full. There's lots of stuff going on. And as much as they would want to share time with you, they won't be able to. So we come in. And then we also more or less provide more hope. And it's not, oh, wait, they're looking for more hope given and not a fear driven approach. So, what do I mean by fear driven approach? Well, let's say you don't get pregnant in any particular cycle. Well, the automatic reaction at a fertility clinic is, oh, let's see what's wrong and why you're not pregnant this month. Well, we're coming from a different angle. Absolutely. Well, we want to help correct and create balance in the body, mind, and spirit, get the cycles in order, get you in order. But when you have a negative pregnancy result, it's not necessarily that anything's wrong, right? It could also mean that it's just not right. And maybe perhaps there's nothing wrong at all, because in my previous posts, I tell you, and in my book, I tell you that even a 20-year-old has a 20% chance of getting pregnant every month. So again, that means 1 in 5 chances of getting pregnant per cycle, meaning there's a 4 out of 5 times having sex in a given month, you will not get pregnant as a 20-year-old. So why do we jump the gun and automatically assume that there's something wrong? So that's where we're talking about in terms of providing hope. We're going to give you a different perspective, which is awesome. And then, what's lacking at clinics? Understanding that fertility treatments impact the whole body. And I will add in mind and spirit, right? Because it can certainly drag us down. So that's what it is. And again, these are 50 patients that we grabbed surveys from. What did they get? Well, they actually got emotional support, improved menstrual cycles, good education, relaxation, better overall health, improved mind-body connection, advocate to help make the right decision, improve sleep and treat insomnia, increase uterine lining for receptivity, and they're referred by friends or what's this? Referred by friends who it worked for. So yeah, some people come because their friends have had success, so automatically they're like, yes, I got to try it. So that's some come because they want to avoid more miscarriages because they've had multiple miscarriages. Some come because, and they find that it increases energy, and again, the whole relaxation response, and then easing the side effects of hormones, and that's what I said earlier. So why should you care? Well, if you want to go through trying to conceive and think, gosh, I don't want to regret, and I want to know that I've tried everything possible, and you walk away feeling more at peace, knowing that you've done everything that you possibly can in your control. And so that's important because, as you know, for anybody who's been trying to conceive for any period of time, there's a big sense of loss of control. Really, I mean, there is no control. That's the point. And so what you want is to have some semblance of control in what you do and in your life, and choose what you need to choose in life. So for example, that's why lots of people will look at their diets, which is very useful, of course, and then look into their exercise or lack of exercise, look into how they're being in their life, how happy and how sad they are, all the rest of it, and address it. So certain things that they can control, and which includes going for different kinds of treatment outside of the Western fertility drug treatment and protocol-based surgical procedures. So that's it in a nutshell. And by the way, acupuncture has become more and more popular, so much so that I would say about even 7 years ago, we had about 50% acupuncture patients that were fertility related, and now we're up to like 80%. So we know that there is a demand, and for those of you who haven't done it, then it is a really great, excellent option for you. And for those of you who have been doing acupuncture for some time and wondering, gosh, I'm not pregnant yet. Why am I doing this? If there's that niggly of questioning, it's like just remind yourself, what evidence do you have that has you feel a little healthier, a little more at peace? And what symptoms have shifted as you've been doing all this? And really, there should be some shifts. And know that you are doing everything possible. And that you're, one step closer to what you're wanting to achieve. But having said that, I would also request that you look at the here and now and be okay in the present moment and not just live for the future and what you can't control. So just think of one thing that you can do. So this is my little quick tip for before signing off. It's like, think of one thing that you can do for yourself today that'll make you happy. And all it can require is like 10 minutes, right? So it's not taking extra time out of your day, but it's something good and healthy and soulful that you can help for yourself. Does that make sense? All right. I believe that is it for now. And I am going to sign off. So I really want to thank you for joining me. And if there are members of the Canadian Fertility Andrology Society watching, which I doubt because these are typically doctors or maybe nurses from fertility clinics, I don't know, whoever it is, if you're able to join, awesome. And if you can't join and you're actually going to your fertility clinic and you happen to be in Canada, let your doctors and nurses know and get them to tune in. And they can sign up from Canadian Fertility Andrology Society. They probably missed it on their on their, what's it called? Their emails, because I missed it myself. Like, I didn't even get to see it. So they can search for it in their inbox from CFAS. And it's about a reminder for a webinar, and that's tomorrow at 3 p.m. Eastern Standard Time. So get your docs to watch it, because I think it'll really help them take care of you in a better and holistic way. And get your nurses to watch it, and anybody who you'll actually talk to at the fertility clinic, because it'll help them help you. And the more we collaborate, the better it is in your personal care. And the more we're able to communicate, that is the ultimate. Because, as I said, most people, most doctors and nurses, they're too busy to spend that much time with you. So imagine you go see your acupuncturist and you tell them, gosh, like, as I'm going through this treatment, I'm having a hard time, not just because of the fertility treatment, but my dog died, my mother's sick in the hospital, and I'm between jobs. Like, it's just really tough. Well, guess what? Your doctor just sees your uterus, your womb, through an ultrasound. They don't know what's going on. So I can actually go and say, hey, give a little email and say, just so you know, they're a little stressed because this is happening in their lives. And then they'll have an insight and go, whoa. So instead of judging you silently in your heads, like, no wonder she's so miserable, they'll actually have more of a compassion when they deal with you. And perhaps they'll even remember you more. We'll see, right? I mean, that's just one thing. There's so many other things that would be helpful if we all collaborate together and work together, because, we're here for you. So I'll stop blubbering. And so do watch my posts down below, or alternately, go to my website. It's marywong.life, and I have them all posted up down there. And I'm so excited because we've transferred them to YouTube, so you can watch them as YouTube videos. So that's very cool, and that's new. And in a couple of weeks, again, as I've mentioned in the past, we'll be starting an online monthly live program for patients, for people who don't want to have their friends and relatives know that they're on Facebook watching something about fertility. You can, for a small fee, you can literally ask me questions and I'll answer them live. But of course, I'll take you through some kind of a learning, some tactical tools to deal with fertility and your fertility journey. And that's it for now. And if you don't have my book, pick up my book, Pathways to Pregnancy, at any bookstore or online, Amazon, of course. And you know what? For those that are watching, if you read my book and you like it, I guess anybody, but if you read my book, I would love for you to go on Amazon and write a review. Please do that so that other people can have perspective on what my book's about. Hopefully you've benefited from it. Love you all. I'm rooting for you, and we shall talk to you next week, Wednesday, 8 p.m. Eastern Standard Time. Take care. Bye for now. Mwah.